Science is fighting back as we face a terrible flu season. Tonight, 9 News takes you inside Sydney's Westmead Hospital, where new technology tests emergency patients for the deadly virus within an hour.
This is what the flu virus looks like. Special imaging reveals tiny green particles invading human cells. And across the country, that same virus has been linked to more than 230 deaths.
This flu season we've seen a lot of activity. It's unusual.
This is the busiest public health laboratory in the state, based at Westmead Hospital. Last week alone, this lab, which operates 24/7, processed an extraordinary 1,300 swabs for the flu. This newer technology diagnosing emergency patients within an hour.
First of all, the clinicians act on the result, do all the management, antiviral therapy, stopping unnecessary antibiotics.
Positive swabs are then sent upstairs to a separate lab for further molecular processing. A special substance is added to that sample to decipher over 12 hours in more detail which types of influenza A or B is to blame. In New South Wales, the H3 strain has been dominant.
The H3 strain tends to affect older people, and so the more severe disease is usually seen in older people.
This lab is one of 3 in the country that works with the World Health Organization to monitor flu strains. All the data is used to help prepare for next year's vaccine. Professor Dwyer says it's too early to say whether this year's vaccine has been a good match for circulating strains, but it's still important to be protected, especially for those with chronic disease.
Western Sydney and southwestern Sydney seem to be most affected by influenza.
It's still unknown when the flu season will peak. Gabriella Rogers, 9 News.